All right, so welcome back to part 4 in our articulations lecture. So in this part, what we're going to do is we're going to look at our third and final structural classification of joints, which are synovial joints. Now with our synovial joints, I'll let you know, there are various types of synovial joints, and then there's even kind of subtypes of the subtypes of joints, right? And so we'll talk about specific types of synovial joints based on the number of axes of movement. So one axis, two axis, three, or none. And then we'll talk about more specific types. So hinge and pivot and gliding and so on and so forth. All right. So before we do that, we need to first look at a kind of model or a general image of what a synovial joint looks like, right? And that's what we see here. So a synovial joint is two bones joined together by a synovial membrane within a joint capsule, all right? So here's one bone, so say here's a proximal bone, here's a distal bone. Joining these two together, you have a joint capsule, which you see as this gray connective tissue structure here, right? On the deep surface, on the deep side of the joint capsule, you have what's called a synovial membrane. And the synovial membrane is a synovial fluid secreting structure. It's lined with a epithelium. It's lined with a tissue that secretes synovial fluid into what's called a synovial cavity. So here's the synovial cavity or the joint cavity. In this, you would have synovial fluid, and the synovial fluid is coming from the synovial membrane. Okay. Because of this fluid and because of this space here, our synovial joints are going to be diarthrotic. Okay, so they're going to be very mobile, very movable joints. And we have many of these in our appendicular skeleton. You don't have as many, if any, you do have some in the axial skeleton, but you have far more in the appendicular skeleton. So associated with the upper extremity and associated with the lower extremity as well, right? Now, you also have some accessory structures that you can find at times in a synovial joint. So you can have articular cartilage that is on the surface, and this is what we talked about whenever we did endochondral ossification, and we retain some cartilage at the end, and you see that here in blue. And then you also see where we had the epiphyseal plate, but it is now an epiphyseal line or an epiphyseal scar, right? So you can have cartilage. You can also have what are called menisci. So in the knee, you have a medial and a lateral meniscus that again help with shock absorption and compression absorption. And sometimes there are what are called intercapsular tendons as well, and we'll look at some of those whenever we get to various specific joints later on in future parts of this lecture. Okay, so answer this question, and then we'll begin looking at specific types of synovial joints. Right. So answer this question, pause the video, and I'm going to go ahead and state the answer. So which is the correct order of joints from least movable to most movable? Hopefully you were able to select the option D, right? So sutures are synarthrotic joints of the skull. Symphyses, this is a cartilaginous joint joined with fibrocartilage. Amphiarthrotic, slightly movable. And then synovial joints are what we are about to talk about, but we've already alluded to the fact that they are diarthrotic, right? They are very movable, okay? All right, so what we'll get into is we'll talk about 4 general types of synovial joints. And again, as we said previously, we're going to define them based on the number of axes of rotation, or the number of axes of movement, all right? So you can have one axis, you can have two, you can have multiple, which is really 3, okay? So 1 is uniaxial, 2 is biaxial, 3 is multiaxial, and then you can have what are called non-axial joints. All right, so we'll start with 1 and then progress forward. All right, so the first one is called a uniaxial joint, right? Uniaxial joints, sorry, let me go back. Uniaxial joints allow for 1 degree of freedom. So we said previously that the degree of freedom is the number of axes that a joint can pivot around or move around. And so in this case, you have 1, right? So a very good example of this is the elbow joint, right? The elbow joint is specifically a type of hinge joint, okay? So if you think of a door, if you're looking, if there's a door near you, you can look at it and you'll see that that door has maybe 2 or 3 hinges, okay? That door that you're looking at, if you see a door, if you can picture a door, that door can only have one set of movements, okay? If it's just an ordinary door, the door can open and the door can close. The door doesn't do anything else other than open and close. So our elbow is like the door. Our elbow has one set of movements. The elbow can flex and the elbow can extend, right? So you have one plane, one axis of movement, okay? So if you think of a hinge, it can flex So you can decrease the angle or you can extend and increase the angle, right? So a hinge joint is one type of uniaxial joint. You also have pivot joints, right? Pivot joints allow for the rotation around another structure. Okay, so in this case, you have the proximal radial ulnar joint. So here's the radial head, here's the radial notch of the ulna, and that head will pivot and it will rotate along that radial notch. This is also occurring at your um, atlantoaxial joint, which is the joint between the first and second cervical vertebrae, right? This joint allows you to shake your head no, right? So you can shake your head side to side to non-verbally indicate no, and you are utilizing a pivot joint, which is a type of uniaxial joint. And again, uniaxial joints are types of synovial, right? So if you ever get confused, try to think of this hierarchy. Okay, so I'm talking about a pivot joint. I can only move a joint in one set of directions with a pivot joint. So that's uniaxial, one axis of rotation, 1 degree of freedom. And then that uniaxial joint is a type of synovial joint, right? So kind of go through this hierarchy if you ever get confused or lost, all right? So the second type are called biaxial joints, all right? And biaxial joints permit 2 axes of rotation or 2 planes of movement or 2 degrees of freedom, right? These are all saying the same thing. So one type is a condyloid joint, right? So a condyle, when we talked about terms related to bones, a condyle was a round, smooth kind of projection of bone, right? So a condyloid joint is very similar, right? So you have this ovoid or kind of round shaped process that articulates with a slight concave end of a bone, right? So the joint between our distal radius and our carpals at our wrist, this is a condyloid joint. The joint between our metacarpals and our first phalanges, so the metacarpal phalangeal joint, sometimes called an MP joint. This is another example of a condyloid joint, which is biaxial. So if you think of your fingers, so think of your that first row of knuckles that you think of, right, kind of near the back of your hand. And if you hold up the number 1, like you're indicating number 1, you can move that finger forward and backwards, right? That's one axis, one plane of movement, 1 degree of freedom. You can also move the finger side to side, right? So you can move it from left to right, you can move it front and back. When you put those together, you get circumduction, okay? But you're only utilizing 2 axes, right? You're utilizing the flexion extension axis and the abduction adduction axis. So 2, so you get biaxial, okay? You also have one called a saddle joint, right? A saddle joint is a very unique joint, and really the only place we see a saddle joint in the body is at our thumb, right? So between, if you look here, in between your, let's see here, in between our first metacarpal and in between the trapezium, which is one of our carpal bones, okay? So what you get is you get this nice overlapping kind of closely united structure, right? So this one up here, this would be the, say this would be the trapezium. This lever down here, this position, this structure down here, this would be the first metacarpal, so of the thumb. And these two can move around each other, and they're somewhat shaped like a saddle, right? So that's where you get the term saddle joint. This again allows for 2 planes of movement, 2 axes, 2 degrees of freedom. You get a flexion and extension, and you also get an abduction and an adduction. So when you put those together, you can also get a circumduction, okay? But the circumduction is a result of the flexion extension axis and the abduction adduction axis. So the carpal metacarpal joint of our thumbs. Okay, so of the pollex. All right, the next type is a multi-axial joint. All right, and the good example of this is our ball and socket joints. Right, so think your shoulder, think your hip as well. Right, so the ball and socket, you have a ball-shaped end of a bone, and you have a socket-shaped end of a bone. Right. So the ball in this case would be the head of the femur or the head of the humerus, and the socket would be the acetabulum of the pelvis or the glenoid fossa or the glenoid cavity of the scapula, right? And so with this, because it's multi-axial, you get 3 degrees of freedom, 3 axes of rotation, right? So you get a flexion extension axis, you get an abduction adduction axis, and those 2 let you have circumduction. And then you also get a third, which is rotation, right? So you can flex and extend your shoulder. You can abduct and adduct your shoulder. And you can also rotate your shoulder around a longitudinal, axis, right? So you see this in the shoulder and you see this in the hip as well, right? So flexion extension, that's one axis, one plane of movement. You get abduction, adduction, and then you get rotation as well, okay? So these are both joints that are very mobile, right? So you get a lot of mobility, so that means they're slightly less stable, but you have a difference between the shoulder and the hip. So the acetabulum, and we'll see this in later parts when we look at specific examples of joints, the acetabulum is much deeper than the glenoid cavity. So that means that the hip joint is much more stable than the shoulder joint, but that also means that the hip joint is less mobile than the shoulder joint as well, right? And you can test this for yourself. You can move your shoulder far greater with far greater range of motion than you can your hip joint, all right? All right, and then the last type that we'll look at here is the non-axial, right? And so this one, there's no real defined or identifiable plane of movement or axis of movement. So these are sometimes referred to as gliding joints, okay? So think of two flat bones or two kind of short bones that are just moving past each other very subtly and not to a point where you really notice it a whole lot, all right? So this happens between our carpals. It also happens between our tarsals as well. So there's very minimal movement. So there is some movement, right? So these would be considered amphiarthrotic joints, but they're just very slightly gliding past each other. So they're sometimes referred to as gliding joints. Sometimes they're also referred to as plane joints as well, because there's two flat planes that are moving next to each other, right? So you have a flat or nearly flat surface that glide past each other in different directions, okay? You can also see this at the sternocostal joint as well, right? So we will stop here and we'll pick up with our next part. I believe this is we'll pick up with part 5 by talking about specific examples of articulation. So we'll look at specific joints throughout the body, and we'll look at their structural classification, their functional classification, as well as any other important features about them.